Hey guys, welcome back to my channel. So today I'm going to start with the new subject, that is pharmacy practice 7th semester question and answers as per RGUHS question bank. So today I'm going to solve the first unit 10 marks question and answers as per RGUHS. If you need the question bank for pharmacy practice, just do comment down below. Definitely I'm going to share with you all. So I'll start with the first question. Describe hospital organization with the help of chart. So this is the chart for hospital organization. In that, number one, that is board of trustees, which is divided into four parts: personal, administrative staff, executive committee, public relations, where the personal is divided head clinical services and the administrative staff is divided as head specialized services, and executive committee head pharmacy services, public relations administrative staff, where the head clinical services is divided broadly in medicine, surgery, radiology, pathology, blood bank, clinical laboratory, whereas head specialized service is divided broadly as a physiotherapy, central sterile services, nursing services, dietary services, as well as manufacturing, whereas head pharmacy services are divided as distribution, drug purchase, and medical record. So the administrative staff is divided as credit services, and it also grants the contracts, and lastly laundry keeping research, whereas the organization of the hospital is a process in which various managerial activities are involved in a proper running of hospitals, which brings people together and binds them together for the achievement of a common goal and the objectives of the hospital. So the most important body of a hospital is governing, which states the body or the hospital of a board of directors or the board of trustee, which may lead the hospital, which governs the hospital, which may be included politicians, social workers, as well as the personalities of the different fields. So the medical staff in the hospital are, there are many people who work together to provide the successful treatment in the hospital. So the staff can be broadly classified as a doctor, nurses, pharmacist, allied health professionals. What is mean by allied health professional in the sense means physiotherapist, or maybe a pathologist, then maybe some other etc. And lastly support staff, where these are the peoples who plays a major role or the important role in the treatment and recovery of the patients. So in that, the number one, that is doctor have a different roles and responsibilities based upon the level of how they are experienced for the medical specially. So the roles which includes in the doctor are senior or residents or like interns, so who have completed, just they have completed the studies and now they are finishing for the final year in hospitals, whereas the seniors consultant who are specialist doctors in the specific matter or in the specific organ. So next they come as nurses. So like the doctors, the nurses have different roles and responsibilities based on their experience and the specialties they have. So the role of the nurses, which includes the maintaining the ward, firstly maintenance of the ward, and clinical work like giving injection, doing bandage, and helping the doctor in the operation theater, and maybe provide some basic medical care like checking the blood pressure, diabetes, or hypertension, or blood glucose in the supervision of the doctor. So the allied health professionals, these are the university educated practitioner who work for the part of your multidisciplinary healthcare team. So they assess or they diagnose the treatment, or they treat in the such a condition to prevent the disease, or prevention for the disease and disability of the disease. So some example for allied health professionals like as I said you, physiotherapist, speech pathologist, pharmacist, occupational therapist, and nutrition, dietitian, etc. So, in the sense, the other hospital staff are like keeping hospital running requires a great deal for the organization as well as the administration. So during your other hospital support, where the staff, other hospital staff may be clinical assistants, like they take care of your ward, or housekeeping, like patient services assistant, bringing meals or drinks to the patient, and as well as the ward boy, the staff of the reception desk. Where the next question, that is classify hospital using different criteria and mention their functions. So hospital can be classified in the number of following with 5 types of classification. In that number 1, basis on the clinical basis on the ownership and control, basis on the different system of the medicine, and basis on the size, and lastly basis on the cost. So I'll start from the first one, the first classification on the basis of clinical. So clinical basis on classification, humans are infected by a number of different diseases. So different diseases have need a different modes and means of the treatments. On the basis of different types, the clinical treatment is classified as number 1, that is medicine hospital. So they are general purpose for the hospital. They provide the treatment to the common people of the country. So there were no boundary or a margin between the type of the treatment that they are provided, and as well as there are different types of hospital which are specialized care for the particular type of the diseases, like general hospital or a family physician, pediatric hospital, and communicable disease hospital, mental or psychiatrist disease hospital, drug addiction or rehabilitation hospital, dental hospital, as well as cancer hospital. So in that number 2, that is maternity hospital, which is used for the childbirth, or maybe for the problems which get to the female reproductive system, along with the antenatal, that is during pregnancy, and neonatal, that is newborn baby child care. So the surgical hospitals, these are specialized to perform a surgical operations. So there are many types of surgical hospitals like orthopedics and cardiotoxics, general surgery of any kind, neurological, or the kidney hospital, which is related to the kidney, as well as the dialysis services. So number B, that is second classification. So on the basis of ownership and control, according to this type, the classification is divided into two types, that is number one government hospital or number two that is non-government hospital. Whereas government hospital, in that A, public health service, PHS, public health services center, or civil hospitals like AIMS, in which is situated at New Delhi, postgraduate institute of medical education and research, which is in Chandigarh, and Pondicherry government hospitals of different cities, universities, health centers, etc. All these are associated with teaching institute like medical colleges. Whereas number B, that is military hospitals for the army persons or the for air force persons or the navy persons. Whereas number two, that is non-government hospital, in that A, private run hospital for profit, example Apollo hospitals, Escort, Sterling hospital, etc. And number B, that is charitable trust hospital, which example Ram Krishna Mission Hospital, which is in Calcutta, and Christian Missionary Hospital, Vellore, and Molaji Bhai Hospital, etc. So number third, C, that is on the basis, third classification, on the basis of system of medicines. So apart from allopathy system, the medicine in India, there are some other systems which are also followed. So these classification are hospital basis on the base of medicine. In that number one, that is allopathy, homeopathy, Ayurveda, Unani, and naturopathy. So the fifth classification, that is on the basis of size. So based on the number of beds available in the hospitals, they are classified as large hospital beds 1000 to or above, maybe medium hospitals 500 to 1000, small hospitals 100 to 500, or very small hospitals like beds which is less than 100. So number fifth, that is last classification for hospital organization, that is on the basis of cost. So cost is very important for the purpose of hospitals. Based on the facilities what they provide to the patient, overall the cost of the hospital increases. Like elite, number one, elite hospital, they are symbols like high technology and as well as advance in the medical science. They have rooms occupied with TV, refrigerators, telephones, AC, etc. As well as the room rates are also comparatively high. These elite institutes have provision for some people for the treatment and stay. Where the number second, that is budget hospital. So the hospital which is made or meant for the middle class family or lower middle class peoples, like civil hospitals and charitable hospitals. So the functions for the hospital is an integral part of a social and as well as a medical organization. For the function which they provide a population to complete healthcare, both for curative and preventive, the various functions which involves in the hospitals, like patient care, education services, the doctor or the assistants which provides an education services to the patient, and general public health care. So the other functions of hospitals are diagnosis and treatment for the disease, outpatient services, prevention of diseases, and promotion of health. So the next question, that is describe the function and objectives of a modern hospital. So for the functions of modern hospital, you have to refer question number 2, and I'll start from the objectives. In that, number 1, that is primary hospital, PHS, primary hospital services. So they provide the first contact between the individual and the families with the health system. primary hospital aims to serve the community, and their functions are in that number 1, care for mother and child, which is also include as a family planning and immunization and vaccination and prevention and communicable of endemic diseases, treatment for the common disease or injury, and providing some knowledge about diet, nutrition, and safe drinking water. So, in India, primary hospital facilities are provided through a network of sub-centers. So, the primary health centers in the rural area, whereas the primary health center staff is head or governed by a medical officer or a paramedical staff. So the secondary hospital, these are those patients from primary health care are referred to the specialist in a higher hospital for the treatment, like district hospital or a community health center at block level. So the tertiary hospital, these types of hospital is known as a high specialized hospital, usually for inpatients, which is referred as a primary and secondary hospitals for advanced medical investigation and the treatment of the patient, as well as these hospitals provide an additional care services and remain open for 24 hours every day. So the next question, describe the organizational chart of the hospital pharmacy. So in that, administrative, which leads to head of the pharmacy services, and they are broadly classified as 5, that is dispensing chemist, clinical chemist, manufacturing chemist, quality control pharmacist, and as well as medical store pharmacist, where dispensing chemist is divided into 2 types, that is inpatient and outpatient, and the manufacturing chemist, that is manufacturing of IV fluid and other manufacturing services. So this is the layout. Whereas the organization of hospital pharmacy is only responsible for the efficient running of hospital, as well as the hospital pharmacy consists of dispensing section, manufacturing section, quality control section, and as well as clinical pharmacy section. So coming to the next question, that is number 5th, describe the location, layout, and infrastructure for the hospital pharmacy. So location of the hospital pharmacy, it should be laid in such a way that there is a continuous flow of man and the materials. In multi-story hospital, the pharmacy should preferably located on the ground floor, especially the dispensing unit, so that the patient and the staff can be easily approached to it. Whereas some other facilities on the location as a separate area for the drug information services and the space, a sterile product room, a store room, pre-packing and labeling room, a compounding room, or an office for the chief pharmacist. Fluorescent lamp are placed above the prescription counter, and floor of pharmacy should be smooth, easily washable, and acid resistance, where the infrastructure for the hospital pharmacy, head of the hospital pharmacy department should be a postgraduate in the pharmacy, preferably they are pharmaceutics and pharmacology or the hospital pharmacy. So the direct superintendent of pharmaceutical services or a chief pharmacist should be M.Pharm. So the pharmacist in drug distribution department should be diploma in the pharmacy or bachelor's of pharmacy, whereas for quality control there will be 2 pharmacists in the department, whereas B.Pharm or the D.Pharm they are required. Where the layout for the pharmacy, so table number 1, you have to refer question number 4 for the table number 1 or the layout of the first and the second layout. This is the second layout for hospital pharmacy. And where coming to the next question, describe the scope and the responsibilities of hospital pharmacist. So the scope, what was the scope for the hospital pharmacist? So dispensing of drugs and the medicines as per the prescription of the medical staff, whereas management of the stores will be purchase a drug or a medicine, etc., providing instructions to the proper stage or such drugs or medicines which will be maintained in the proper records of the drugs or distribution and manufacture and distribution of the medicaments and the products such as transfusion, whereas fluid and the other parenteral products which are not manufactured and marketed, where tablets, capsules, ointments and other externally used preparation, whereas even stock mixture. So providing TDM, that is therapeutic drug monitoring services of studying effect, where the various drugs are administered to the patients, especially the indoor patient, from the patient chart which is maintained in the ward, etc. And establishment and maintenance of the drug information center, patient counseling services, maintaining the liaisons of medical staff as well as the nursing staff with the patient, and to maintain the nursing department and the central sterile unit, whereas to participate in teaching programs of the nursing as well as pharmacy students. So what were the responsibilities which have taken for the hospital pharmacies? They provide the pharmaceutical services and other medical services to the patient, and to employ and advocate the component staff, and to develop and to maintain the effective system of the clinical as well as administrative records and the reports of the patient, to make plan for the hospital pharmacy administration, and to prepare the financial plan for the hospital, whereas management of the stores, which includes purchase of drugs, proper storage condition and maintenance of record. So dispensing and sterilizing of parenteral preparation which is manufactured in the hospital, whereas to prepare and implement the safety programs in the hospital, and maintaining the liaisons between the medical staff and nursing to the patients, whereas discarding the expired drugs that are contained, and even dispensing of medical drugs and medicines as per the prescription, that is RMP, and proper storage of the drug, establishment and maintenance of drug information center, and lastly to provide a right medication at the right time in the right dose at the minimum possible cost. So this is the responsibilities of a hospital pharmacy which can be given to the patients. So the bed strength and number of pharmacists which is required for the responsibilities of a pharmacy which is present in the hospital pharmacy. So up to 50 beds there will be number of 3 pharmacists, and 100 beds 5 pharmacists, 200 beds 8, 300 10, and 500 beds there will be 15 pharmacists which is required in the hospital pharmacy. So the next question, what are the roles and the responsibilities for the hospital pharmacy in various area? So you have to refer question number 6 for the roles and responsibilities of the hospital pharmacies in various area. So here we have completed the 10 marks of first unit pharmacy practice 7th semester. So tomorrow I am going to give you the next semester. Please do like, share and subscribe to my channel.